Y'all can, man. Y'all can share this. I don't mind. I don't mind, man. Share this thing, man. Cause the whole state of Mississippi need to be aware of what I'm about to say. You dig what I'm saying? That's about the only way it's gonna just get the change. People gotta speak out a little bit. You dig? Share this here, man. Share. I'm talking about put it in your groups and everything. Real, man. We need as many people as we can on this here, man. Trying to see. It say it ain't nothing but two people up there, man. Marnay, bro. Yeah. So what I'm gonna do is I'm finna go in, man. I'm finna go in on the topic. Marnay, you already know it, baby. Yeah. First issue I wanna speak on is this here. Okay. I wake up today. It's like every day I wake up, or every other day, somebody else done died at MDLC. I don't know what the hell. I don't know if it's in the water. I don't know if it's in the food. I don't know if it's just in the hearts of these damn administration and these officers that work at those prisons. I'm not exactly sure what it is, but I'm knowing that every day somebody dying. You feel me? We losing somebody every week, if not every day. You know. Okay. Death toll right now is at like 21, if I ain't mistaken. You dig?
We still trying to get the people. We still trying to get the people to come here, just laying here. You can see right now in the front of the zone, guys are everywhere. We can't get no officers, no staff. We can't get nobody present at all. I'm saying, man, to get to a man, we got a man that's been laying here for hours. He's been laying here for hours.
So this is what social distances look like inside a prison. As you can see, I'm showing you the day room with the facility that I'm at. And as you can notice, there's a number of inmates freely walking about in the day room. So all it takes is just one person in here to become infected with the coronavirus, and it's a wrap. Everybody's going to be infected.
How in the world is this system going to deal with COVID-19?
All it takes is for one person to come into this environment that's affected, and boom, you got a crisis on your hands. And my biggest concern is it's not so much getting it from the prisoners, it's getting it from the correctional staff.
What are the correctional officers doing when they're coming in? Are they getting checked for fevers?
Well, I've been informed that they are being screened each day that they walk in. This is not one of those things where you can just simply ask if someone has symptoms and clear them to come into work into a dense populated area.
If you started feeling some of the COVID-19 symptoms, how long would it take you to see a doctor?
They have a nurse that's visiting the building every day. The problem with that is, I think for most prisoners, they would be afraid to report that because it automatically is going to result to them being isolated in the hole.
In terms of the commissary, are you able to get Lysol wipes, bleach, anything to disinfect and keep your area clean?
I gotta laugh at that. Are you kidding me? The commissary don't sell nothing but junk food. You hear me? In terms of disinfectant, as a matter of fact, they have a limitation on the number of soap that you can buy.
So how are you supposed to wash your hands as often as we're supposed to wash our hands with just 4 to 6 bars of soap a month?
I think you just answered the question to one of the biggest contradictions. So on paper, it looks good. When you look at what their protocols are for this, they're talking about they're passing out extra soap, that they're doing extra cleaning, that they're passing out disinfectants of this type of and sort. Yeah, that's not the reality in here. This is what's happening right now inside the California Department of Corrections. We're sitting ducks in here.
Good evening. On Thursday, the count has been released by Illinois governor, who has stated that 157 individuals have died as the result of this virus, the coronavirus. There are 52 people in the Illinois Department of Corrections that have tested for this virus. There is more than a dozen brothers and sisters that are called and labeled as inmates that are in St. Joseph Hospital in Joliet, Illinois. And I want to announce that this morning a class action lawsuit was filed on the behalf of Illinois prisoners at risk.
Dominique Jones, and you have to excuse my quarantine look. If I look like I'm tired, it's because I just recently had twins. They're 2 months old, so I am tired. Most importantly, I am exhausted. Between homeschooling my 6-year-old, a 13-year-old, and the twins, and dealing with prison reform, trying to get these people to protect our loved ones, I'm tired. I just got off the phone with my dad. My dad has been incarcerated for 37 years. He is an LWOP. He is currently 62 years old on his 37-year of a life sentence. He's been incarcerated my entire life. All right, I'm coming. It's my son looking for me. And he said that he thinks that they are about to move him to Camp J, and that they're going to use Camp D as a storage house for dead bodies. Keep in mind that my dad does not have Lysol, he does not have rubbing alcohol, he does not have anything, but he did tell me he has some bleach and some antibacterial soap. When I asked him this morning, I said, well, what are you going to do when that runs out? He said, well, I just need you to make sure that I have money on my account, so every time it becomes available, I can buy it and stock up on it. So Camp J, where they're moving him to, has already been contaminated with COVID-19. It's not going to be clean. And they're just going to move him there. So not only am I not going to be able to see him, if I don't keep money on his Securus account, he calls me from his J player. He doesn't want to use the public phones because they're not clean. So you're telling me that you're going to move my 60-year-old elderly father to a facility that is already contaminated with COVID-19? Like, what am I supposed to do? Like, how am I supposed to be okay with that? And then he tells me, Dominique, if I get sick, I'm not going to the infirmary, because if I do, I'm not coming out of there. You know how hard it is for me to hear my daddy say that? I don't have siblings with him. I'm his only child. I get help from his siblings. He has 2 older sisters and a brother, and his mother is still alive. How am I supposed to tell her? Like, how am I supposed to tell her this? And I saw the letter from Attorney General Jeff Landry saying that he does not think it's just a good idea to release prisoners. How in the hell would you feel if your children weren't able to talk to you, if your children weren't able to see you? How would that make you feel? Right or wrong, 37 years is too damn long for anybody to be incarcerated. This man got 4 grandkids. What the hell he gonna do in his 60s? Like, I just think that we are killing our own people. We're killing everybody that we need to actually. And on top of that, if my father was to pass away in prison, I don't have money saved to the side to bury him. I can't get life insurance because he belongs to the state. So what am I supposed to do? People tell me now, you have to calm down. You gotta stay level-headed. Well, you know what? I never even took maternity leave. I actually kept working because I had no choice. Because the girls in my mentoring program, they need me, just like my children need me. And here we got the Attorney General for Louisiana not wanting to release people. How inhumane is that? Like, how do you sleep at night knowing that you mistreat people like this? I don't even know, like, you won't make video calls available. You give us 2 free phone calls per week and 2 stamps. Yet in this big old pandemic that's going on in this damn world, nobody's working. And instead of me using money to actually pay bills, I got to use the money to put on my daddy's phone call so I can make sure he's alive. What am I going to tell my grandmother? And y'all don't know the type of grandmother I have. My grandmother. Like, how do you tell a woman that her son, if he gets sick, he's not going to the infirmary for help? How do you tell a mother that? How do you tell a mother that they're about to move your son to a place that's heavily infected with COVID-19? He's never even met his twin grandchildren. I certainly hope that Governor John Bel Edwards does not take the advice from the Attorney General. I certainly hope that he listens to the people, that he listens to the community. He listens to the organizations that helped get him elected and does what's right for his community, for his state, for his people. Because what's going on right now is certainly not right.
Hey, this is Julian Grace for WRAL. I want to give you a perspective on exactly where we're at. We're in Goldsboro at the Noose Correctional Institute. There are a number of officers out here. Some of them are in riot gear. They have the prison surrounded here. So let me give you a little perspective on exactly what happened. Today, we learned that two inmates here at this correctional facility have tested positive for COVID-19. Inmates heard about that and they were very frustrated. They feel as though social distancing is not being practiced inside the facility here. So we've been told a number of inmates are in a courtyard and they are refusing to go back in because they're afraid of catching COVID-19. That is why you see, I don't know if you can see all of the officers that are out here. They're keeping us at bay. They have an officer right here that is directing traffic, and there's a long line of vehicles that are out there. We did reach out to the Department of Public Safety. We are being told they are taking measures to ensure the safety of the inmates. We're being told that all of the guards are being examined before they come in. They have to have their temperature taken. If their temperature is above 100 degrees, they are sent home and they cannot return back to the prison here until they have a doctor's note. We have a very candid conversation we had with an inmate over the phone. We hope to have that for you later tonight at 10 and 11. But he talked about the lack of social distancing inside the prison walls here. He said some of their beds are less than 3 feet away from each other. Now, there is some concern, a lot of concern out here in the community that you have 2 positive cases inside the prison here. Some are wondering if the guards could transmit that here to those who live and work here in this community. So there are a number of questions that are out there. We have calls into the Department of Public Safety. They are expected to get back with us more on this situation. We can tell you the inmates are contained to the prison campus here. There's no prisoners running around or anything like that, but there is a very large police presence here. So we are going to stay out here. I know there's a number of people that have a lot of questions about what exactly is going on, but we're still trying to piece it all together. And I can't stress this enough. Some residents are concerned that COVID-19 can spread into the community of Goldsboro if the situation is not rectified here in the prison after 2 inmates have tested positive for COVID-19. So that is what we
breaks out in here, everybody's gonna get it.
CBS 42 obtained these images of life behind bars at Donaldson Correctional Facility.
And that is nearly 100 inmates per dorm. In some dorms, there's over 100 inmates, so there's no way we can stay 6 feet apart.
Inmates on the inside saying none of the CDC recommended social distancing guidelines on the outside are being followed to prevent the spread of COVID-19.
Okay, we cannot be 6 feet apart if I could reach down and touch my bunkmate. And the cells are only 6 by 8 anyway.
In March, the Alabama Department of Corrections suspended all visitation and inmate passes, and according to State Senator Cam Ward,
they've been screening officers coming in every day for fevers or any kind of situations like that, and they're screening inmates. They have an emergency protocol that they deal with any kind of pandemic or virus like this, which means a 60-day standby reserve of cleansing materials such as sanitizers, any kind of soaps and stuff like that.
Here's what the inmates at Donaldson told me.
As far as the inmates go, we haven't given nothing to sanitize this place where.
Can you tell me about soap and water?
If you need some good soap, then you're gonna have to buy that yourself off the store. So, and a lot of people don't have funds to buy stuff off the store, especially when people aren't working right now. So then we need bleach, we need alcohol, we need stuff like that.
Now, unfortunately, these are things that are basically impossible to do in prisons and jails.
David Fati is the director of the ACLU National Prison Project.
Particularly in Alabama prisons, which are the most crowded prisons in the United States. The Alabama state prison system is now at about 170% of its design capacity.
Fati says dense populations make it impossible for adequate hygiene and social distancing.
Public health experts are saying is you have to reduce the population. You have to let people out to reduce the population in the facilities to stop or at least slow the spread of the virus.
A virus that doesn't distinguish between inmates and prison staff.
So we know that if the prisoners have it today, the staff will have it tomorrow, and the staff's family members and the broader community will have it the day after that. So this is a case where we're all in this together, and we all have to work together to contain this.
Yesterday, the first inmate in federal custody died from COVID-19, a 49-year-old Louisiana man named Patrick Jones. This follows weeks of advocates for the rights of incarcerated people sounding the alarm about the potential spread of coronavirus in the nation's prisons and jails.
There are a whole lot of attorney generals, people like that, who wrote a letter to the president saying, let some of these people out of jail now.
More than 220 inmates and over 130 jail staff in the country's 20 largest jails have contracted the virus.
Coronavirus within New York City jails is spreading at a rate, get this, 7 times faster than in New York City itself.
Some states and counties are starting to take it seriously.
New Jersey, Ohio, Illinois, Oklahoma, California, and Texas.
Releasing thousands of low-risk, elderly, or vulnerable inmates.
This weekend, Michigan Governor Gretchen Whitmer passed an executive order
allowing some inmates to be eligible for early release.
We talk about it as though it only affects the population that is actually in these prisons, but this is a public health issue.
There can obviously be no social distancing in a prison because all of our prisons are overcrowded.
We've got more prisoners in America than we have in pretty much anywhere else in the world.
Things like hand sanitizer, that's contraband. It has alcohol in it. Sometimes you don't have soap.
Medical care is in short supply. Medication is in short supply. It's almost as if we've designed a petri dish to spread the pandemic and to heighten this crisis.
So people say, well, why should you care about people behind bars? Well, They're human beings, and just as importantly,
because of the filthy, unsanitary conditions, these 5,000 jails, prisons, ICE detention centers may in fact drive the entire epidemic curve for our national pandemic up just when we are trying to flatten that curve.